Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hello, so in this video we're going to go through the nutritional assessment for OSCE exam. So this is one of your skill stations. It's quite a short station, so it has 8 minutes, but that should be more than enough time if you know what you're doing. So let's have a look at the marking criteria. As always, I would recommend you look this up before you do your exam. So looking at the marking criteria, it's not quite clear if this is a written station or like a practical station. So it's a bit of both. So you will be given a written scenario and then you need to go through that and complete your paperwork. After that, you will need to discuss the patient with the examiner and give a care plan. So that will be your verbal part of the station. So what we're going to do to go through this, I'm going to give you a scenario that I've made and we're going to go through and practice it together. Okay, so first of all, here's your scenario. Okay, so for this scenario, we have a patient called Helen Ahmed. Her age is 69. Height is 160, weight is 45 kilograms, and the scenario, you can see it there. So already from the weight, we know she's probably going to be underweight. So next thing we need to do is calculate the BMI. So don't worry, you don't need to use a calculator or calculate it in your head. You will be given the BMI chart, which is available on the MUST website. So I advise you look this up before you go to the exam. So if you just type in MUST, which is the Malnutritional Assessment, you'll be able to get all the documents before you go to your exam, so you'll be able to review them and familiarise yourself with them. So I'm just going to go with you very quickly how to access the MUST paperwork online. So basically I just put MUST paperwork in Google and it's the malnutritional screening tool. I'll show you on the screen as well by Bappen, and that's the one you will have for your exam. So just have a read through it and familiarise yourself. So first page is some instructions of how to do the MUST. I've read through them now so you know what to do and you understand it a bit more, but in your exam I don't think you'll need to read through them again. You should be familiar with them. So next page is the BMI chart. If you're not familiar with this, if you haven't used it before, I will go through with you. If you know how to use it, don't worry, just a quick recap. So on one side of the chart, you have the weight in kilograms and the other side, you have the weight in stones. And then at the top of the chart, you have the height in feet, and at the bottom, you have the height in centimeters. So you just need to select where your patient goes and meet the 2 points together, and that will give you your MUST score. And there's different colours there. So if it's in the white box, it's obese. If it's in the green box, it's scoring 0. Yellow box scoring 1. Red box is scoring 2. So likely for the OSCE, you're going to have an underweight patient. So they're going to be scoring 1 or 2. That is because, as you know, when we go in the hospital, we have a lot of elderly patients, a lot of very, very sick patients, and they're not eating for various reasons and they are underweight. So that's the kind of scenario they are likely to give you. So let's go through with our scenario and calculate the BMI. Okay, so for Helen, her height is 160 and her weight is 45 kilograms. So I'm just going to go along the chart where those two meet, and that will give me the BMI score for her. So you can see she's scoring 18, which is the red section, so that is scoring 2 on the MUST. And that is the first part of your MUST chart complete. You just need to fill that out, so that's quite straightforward. Okay, so you will have the chart I'm showing here. If you haven't seen this chart before, it is available on the NMC website with the documents in there, so you can have a look at it in your own time. So obviously you're going to fill out patient's details. This should already be done for you, height and weight. And in the first box, you're going to circle number 2 in the red section because the BMI is 18. And then next we're going to move on to calculate step 2, which is the weight loss score. This one's a little bit more complicated, so let's go through it together. Okay, so again with your must documentation, you will be given this chart, which is to help you calculate the weight loss score. So a couple of things we need in order to calculate the weight loss score. We need the patient's current weight, obviously, and their previous weight, how much weight they've lost, and how they've lost it, basically. So Helen is currently weighing 45 kilograms, so we will go down to the 45 kilogram section. And next to that, you will see the colour boxes, green, yellow and red. So then you select how much weight she's lost. So in this scenario, she's lost 4 kilograms. Okay, so she's lost 4 kilograms in the last 2 months. So that fits the criteria to go in the second box, which is for having lost weight in the last 3 to 6 months, and the 4 kilograms fits within there, so that will be giving a score of 1. Remember, this section is for unplanned weight loss, so if you do get a scenario like the patient's been on a diet and lost weight, that doesn't count. Okay, so it's just due to being unwell and losing weight or poor appetite, something like that. So now we're going to go back to our documentation on our chart, and we're going to fill out the next section, which is step 2, and we're going to circle for Helen the yellow box, which is number 1. Next, we're going to move on to step 3, which is acute disease effects. So for this, you need to read your scenario and see if the patient meets the criteria for this. So for step 3, it says if the patient is acutely unwell and there has been or is likely to be no nutritional intake for more than 5 days. So it's very important there that you read it clearly, that they have had no nutritional intake. So if they're having like peg feeding, NG feed, TPN or something like that, that does not count. Okay, so it's if they've had no nutritional intake. So read your scenario, it might be like vomiting or something like that, and they haven't eaten at all, then you can mark this. But otherwise do not mark it, okay? So in our scenario with Helen, it doesn't say anything about this, so we're going to leave this section blank and we're going to score it as 0. Okay, so next step now is we're going to make our total score. So from the BMI, we've got a score of 2. For the weight loss, we've got a score of 1. And for the acute disease effects, we've got a score of 0. So that would give this patient a total score of 3. So you will mark that in the total score box. And you can see on the picture there, it's indicated that this would be a high risk, and then obviously date and sign it and put the time. So remember to complete your paperwork thoroughly. I know it's quite straightforward, this document, but I would always advise at the end of any stations, if you have any extra time, to go through and recheck it. So now you've done this, next part is to verbalise to your examiner the results and the care plan for the patient. Okay, so now I've told you about talking through the care plan, you're like panicking and thinking, what am I going to say? Do not worry. Remember that must document I showed you earlier? On one of the pages there, it says everything you need to know for the care plan. So I'm going to show it onto the screen, and it says after step 4, there's a box step 5, and then there's 3 different categories: low risk, medium risk or high risk. This patient will fit in high risk, and then you just go through everything in that box. And it's quite general stuff that I'm sure you know anyway. Once you go through it, you're going to think, oh, I would have said that anyway. So nothing to panic about, because you will have this document with you in the exam. Okay, so first point, it says refer to dietitian. So I can see examiner, I've completed Helen's maths score. I can see she's at high risk, so I'm going to refer her to dietitian. I'm going to weigh her again weekly. Now I've said weekly because it's a hospital scenario. If you have the community scenario, it is monthly. Other things you will say is I'm going to encourage her to increase her nutritional intake. Seeing as she's in the hospital, we can start her on a food chart. We can offer her snacks, see what food she likes, if she has any preferences, that kind of thing. Okay, so last point on the marking criteria is verbally considers possible underlying causes. So we need to think about that and relate to the scenario. So you might have like someone who's got nausea or vomiting, that kind of thing. So that will be one of the causes for them. So we can say, for this scenario, I think the cause of Helen's weight loss is due to her being generally unwell with the chest infection, and that has caused her to lose her appetite and lose weight. So hopefully when she improves from the chest infection, she will start to regain weight. And that is it for your nutritional assessment. Good luck with your exam.